time is the most important job you could be doing. Always think of your next job. Always think of the next step, the next level of training, the school that you have to go to. And that's going to be your life from here on out if you are successful in nursing. I started out basically started out at University of Colorado in Boulder, and called my dad. I was working towards a degree in literature. I got my degree in literature and had visions of being faculty and teaching literature, English lit, at University of Colorado in Boulder. But my dad was kind of one of these, well, when are you going to work? So sure enough, an Army recruiter got a hold of me, and next thing you know, my basic training rolling in the mud, thinking, well, I can get a scholarship for nursing, and this is the way to do it. So I got my scholarship in nursing, and I went to Army ROTC, and then immediately transferred to commissioning training to Air Force because I wanted to be a flight nurse. And sure enough, waited around, worked at the VA for 14 months in Dallas. I learned a lot. Sometimes when you go to these jobs that are really demanding, really difficult, really hard, and physically taxing, but just, your reward for doing a good job is more work. But embrace it because you really learn to be a better person. And always keep in the back of your mind that passion of what you want to be. You want to be a good nurse. But you also want to know your value. You are invaluable. You don't feel like it most of the time, but you are. And badly, badly needed, especially these days. So nursing is a hot profession. And so I came active duty, and then I became a flight nurse. Started out in pediatrics. I didn't know creepers from crawlers. I never was raised with young babies or kids, but for some reason I have a gift for it. And I don't know why. God gives you gifts. And you just take that gift, realize, hey, I have a gift for this. What am I going to do with it? So I became a flight nurse, was sent to Europe at a time. It was a crazy town, the Red Brigade and communism and bombs and picking up all sorts of people all over our area was the C9, the 130, the 141 pickup area, people in throughout the Middle East. Berlin bombing, which goes way back, picked up those victims. The Red Brigade killed a lot of soldiers there in Berlin, take them to Spain. Aerovac is what we were doing. And also Africa, the Middle East, all of Europe. So learned a lot. And the biggest thing I learned is a team approach in anything you do. The team approach. You go in an environment, even if it's the downtown public health department, when you're in a nursing position, you don't think of just you think of your team. And you develop that team. You develop relationships with that team. You learn that we all have our flaws, work with it. Sometimes you won't be able to. That's when administratively, you learn to do something about it. But learn it's your team that will get you through. Of course, the military is an example of that. The Marines that were bombed, 300 Marines basically killed. We went in there in airback with the State Department and picked them up and then brought them back to Europe for more definitive care. But it was a team approach. We even had pilots out there holding Foley bags. Everybody kicked in and we did well. But again, it's not always about you. It's about you and how you care for others and the respect that you garner. And that will take you a long way. I can't emphasize that enough. Your team. Take care of your people behind you. Develop them, nurture them, teach them. And the benefits far outweigh any negatives. Then, of course, I went on and became a pediatric nurse practitioner, and I did that most of my career. And then eventually made it to the rank of lieutenant colonel, retired because I had a daughter at that point, and I was in the Middle East, got there at the only fixed facility in Turkey. It was great. I thought, wow, I can really retire here. I loved the diet. I had 13 nurses, and I was having a great time. I loved Turkey, loved the people. And then 9/11. And so, sure enough, next thing you know, in 1 month, I went from 13 nurses as the chief nurse there to 64 nurses. Crazy town, all over. The logistics were nuts. But the goal, since we were the only fixed facilities, taking all the wounded, because the war had started, and to until people could build up down the range, in other words, down south, build up those temporary hospitals. We were in all the Middle East. So, interesting times, but I did retire. My daughter was vaccinated. We were apart for about 14 months, and that's the price you pay. I was active duty, and you have to do what you have to do. And she remembers that very vividly, and she's a very strong woman for it. She's an assistant PA here in downtown at the courthouse. Lots of stories to tell there. But she said, you know, you made me stronger, Mom, because I watched you. And this is, you know, our families are supporting us, our families are behind us, and we don't realize we're in the midst of all this hard work and all this effort and struggle. But always take care of your families and take care of your people who are supporting you and your team. I can't emphasize that enough. Moving forward, when I got out of the military, it was one of these, wow, I want to work in the trenches. I don't want to work just in some doc's office, cranking out all sorts of dollars while he's golfing. No offense. But sure enough, I worked for the public health department. I wanted to learn that which we're doing for our own in our own country. I knew all about the military medicine part of it, and that public health portion of it, which is huge, by the way. Lots of opportunities there for employment. I strongly, strongly recommend you at least look into it. And it's not all military people. Huge component of civilians and wonderful benefits. So look into it, don't dismiss it. And you can do a lot, you can develop a passion to do something bigger than what you are. But back to the public health department in Melbourne, Florida, it occurred to me I'm treating more people who aren't children. I was thinking there's a legal liability here. I'm treating grandparents, I'm treating parents. You know, we weren't doing a lot as a country. It was shocking to me. And even in rural health, what we don't do. So I went to George Washington University and got my family nurse practitioner. And it occurred to me, I'm standing behind the graduation of the Washington Mall, like a ton of bricks. And here's somebody who's really crazy about going to school. Dang, I'm going to have to go get my doctorate because I'm standing behind 30 PAs. That's unheard of, getting their master's competition. In order to keep up with this, the writing was on the wall. Education is what they're doing. Education for these PAs, now master's prepared, and doctorally prepared. It occurred to me, I'm going to have to go get a doctorate so that by chance, in nursing, they're going to push this, and they sure enough did. I was part of the class, the first class at Vanderbilt, there were 10 of us getting our doctorate of nursing practice, not a PhD, DMP, because I don't care for research that much. I was more interested in the clinical. And so that's why I went to the doctor of nursing practice. And now, for all advanced nurse practitioners, to that point now I'm PNP and an FNP, you're going to have to go to a doctor. And even if you're not in the practitioner world, and I hope you go to the practitioner world, even if you're administrative area, the doctor, those highly educated people are the ones that promote it. They're the ones that are the bigger vision people. They're the administrators. They're the ones that are going to be the vision of what we want to establish in healthcare. Now, where are we in healthcare? Okay? 2 years ago, I went to Dublin Island, where there was a conference for the International Congress of Nurse Practitioners. In other words, the practitioners internationally. So in other words, in Dublin, they came from all of Europe. They came, this was 2 years ago, all of Europe. They came from Brazil. It's interesting to see their experience and hear about their experience as COVID. You know, we think we had it bad. We had 20-some nurses from Israel. That was before their event. And then we had, of course, all of Europe again, and some from Africa. But a huge group, this organization, International Congress of Nurse Practitioners. We had the World Health Organization, and we had the Secretary of WHO came out and talked to us. And I thought, people seem edgy. What's going on here? Those in the administration. So they came out, and the Prime Minister of Dublin came racing out. It was a big holiday then, but he canceled one of the presentations he was supposed to be doing, so he could specifically talk to us. And here's the situation. Internationally, this is the situation you all are going to look at. We are, in as much as, at that time, 30 million nurses short. 30 million nurses short. In other words, you know, countries like Nepal, countries like Great Britain, countries like all of them are struggling for nurses. Their answer to this is to push the practitioner program so that practitioners, nurse practitioners, can not only be nurse practitioners, it would also bring up the nurses to become nurse practitioners, following our pillars of education. So, you know, with the negative Nelly I can be sometimes and thinking, what's wrong with this picture? That means we're doing it all. You better be very careful with this. Be nurse practitioners following our models of education and also doing a nurse's job. You're doing it all. Because you're in advanced practice, working independently, and yet here you're also taking on jobs to meet this nursing shortage, and that is their answer to the fix. We as nurses have to organize. We have to know our value. We have to stand up for our rights, and we have to know the writing on the wall. In other words, be educated. Keep informed. You really, really have to, it's your obligation to yourself and to others, to know the writing on the wall of what you're going to be pushed into. Okay? That was 2 years ago. Last year, I went to Devil Island. And sure enough, it was the same old mantra. Now, to backtrack though, within 4 months after I got home 2 years ago, sure enough, the Wall Street Journal came out with their article, and it's in the papers. We were 1 million nurses short in this country. So it's happening. It's happening. We are low in nursing. It's a perfect storm. People are retiring. They don't want to go back. They don't want to go back to this COVID mess. We kind of took it in the shorts with COVID. It really did a lot of damage. But not only that, it's generational. You have an older population. Think about now, that means more patients, more work, and less resources. So it's a crazy time right now. Again, be informed. Know your organizations. Know politically what's happening in the world, not only in our country, but the rest of the world, because the world is getting flatter and flatter. Now last year, same thing. Prime Minister, this is our answer. I couldn't help but watch TV and the National Health Institute, you know, in Britain it was, we have socialized medicine, this is great. And their answer to the nursing shortage, for example, in Nepal, and had a shortage already, was to say, okay, come to our country and we will give you citizenship. Well, you just robbed Nepal of 4,000 nurses. And that's what happened 2 years ago. Same thing is happening now with this wheeling and dealing in these countries that really need their nurses. They're taking them with the promises of something better. Well, it's not better when the National Healthcare Institute is falling apart. You have now these refugees now. Look at the wars. What's happening? You have the Ukraine. You have all these things going on in the Middle East, and all these refugees, where are they going to go? Like our country, they're trying to survive. That requires health care. That is more of a demand. So you have a nursing shortage, you have all this migration of people. The world is changing very, very quickly. You have to stay informed. You have to know what it is you want to accomplish. You have to define to yourself what your passion is and how you intend to accomplish this in a healthy, effective way. Keeping in mind, it's not just about you. It's about your families. It's about the kind of quality care you can give. Keep in mind, they're putting more and more on you, and you'll attest to this too, more and more on you. Tort hasn't changed in this country. You can still get sued. You have lawyers out there who are just itching to find safety violations, to find malpractice, to find all of these things that happen. Well, think about it. When you're overworked, when you're tired, when you're underpaid, and you have this volume of people, it does wear and tear on you. But you always have to be always cognizant of safety, safety, safety. And you can't emphasize that enough. The safety is another area, wide open, where you, in Washington, you have the IOM, which is a book, that can, basically what it is a textbook of all the safety violations, you know, the background, what it is, what we do, what we can't do, and it's up, you know, it's upgraded yearly. But it goes into great detail about, you know, the safety considerations for patients. Pay attention to that. It's kind of like the Bible, the Torah, the guidelines for safety, national safety. And what your recommendations are, what the guidelines are, be attuned to these resources that you can refer to. The IOM, for example, something as simple as safety briefings, pre-briefing. Someone codes, you have a pre-briefing or a debriefing. Do you do this in an ongoing way? If there were errors or if things were kind of crazy or it wasn't handled well, the debriefing, they recommend debriefings after every code to decide, okay, who did what, how was it managed, what were the concerns, well, how can we make it better? An example of that, the people that really have it down is the pilot world, the flight world. Pilots do this every trip. Did you know that? Every trip that you go on any kind of, they call it mission. So in other words, you're on a flight. You can count on at the end of the day, the pilot, the crews, the flight engineer, the flight attendants will all very quickly, okay, pre-brief, what do we have? Let's talk about the goal-ins, talk about the captain's philosophy. Any questions, anything, any mishaps, any concerns, or anything I don't know? And then you have a debrief after the flight. Okay, what can we do to make it better? And in the pilot's world, it's interesting. If an error is made, they're in more trouble if they don't report it than if they try to hide it. There is not the hiding of errors that you see in the medical world. There's not this hidden kind of, it's like, we screwed up, what do we do about it? And you find in discussing these things, their incidence of error decreases. So again, safety, safety, safety. And so what the IOM tried to do is to follow those models in the airline world of safety. Safety for them in flying. Safety for us in the healthcare world. So that's another area to look into. And the thing is, I look back and I look at all of you young people, and you have so much to look forward to. It's going to be hard. Nothing is free in this world. But it's going to be just exciting. The key is to know what it is you want to do. And always, when you're doing your job again, look at your job and decide, okay, I'm in med surg. I don't want to do this forever, but I'm going to learn all I can. And I really recommend taking those dredge kind of jobs for a couple years. One, it teaches you a lot. It teaches you about working with people. It teaches you a lot about robbing Peter to pay Paul in terms of putting it all together. Like, we're out of this supplies, but I can make do with this. It's like this, constantly. Because the needs are so varied. Med surg, it's nothing wrong. I wouldn't say stay in it for long. If you like it, you're good, great. Live your best life. But most people, if you can look at it, okay, I'm doing it, but what's my next job? But always remember, the job you're in is the most important job at that given time. Then you can expand out. Take your next step, but kind of have an idea of what that next step is going to be, and don't just fly. So don't get caught up in, well, stay in this job, I can pay off my car. Always think, you can pay off your car, but you can also have a better job down the road and know your value. So, are there any questions? I'll take a pause on questions you might have.
Oh, about half of our class are administrative students.
Mm-hmm.
And one of the things I really think is important is that they do have that communication with the clinical staff.
Right.
Do you have any experiences or recommendations about that?
I can tell you all the time. All the time. Your admin people, for example, going way back, who do you think ran airback? That's air evacuation in the military. All those patients you pick up all over the world. The war wounded, State Department people all over the place. Arranged and coordinated by administrative people. You're always in communication with them. In the hospital, are you separate entities? Make it big. That person's admin. I'm in nursing. Admin are uniquely always there. Most recently, we had in Robstown, when I got here, it occurred to me when I got here, we didn't have a lot of, I felt, this university investment in rural health. I was a little disappointed when I got here. From the nursing perspective, we just didn't. So my thought is, okay, my goal is training. It gives training opportunities for our nurses and for the health sciences. So they need training opportunities. How do we work together to find a site that will work for both? And so, of course, lots of things happened. When COVID happened, and we incidentally also had the same given time, it's called the IMT prior to that. the innovative readiness training. The military has training opportunities not only for the admin that work uniquely and closely with the healthcare world to make it work, put it all together. But we had 600 people come in, troops at Robstown, qualified for this mission, where they would come in, and these people are reservists, and they would come in and say, here we are, what do you want done? Can you imagine 600 Army military people coming in and say, okay, we're yours, where do you want to place us? And so the commissioner of Music County, we call him JAG, Joseph Gonzalez, he's tickled pink because this is his county, and he knew exactly where to put these people in different areas of his county, in Robstown, in the peripheral area. And sure enough, it was a wonderful training opportunity, and in a 2-week period, the dentist did 30,000 extractions. And all of this was set up and coordinated and managed by the healthcare administrator. So because of this, we did so well, we did beautifully, and the students, I think, loved it. It was an interesting, unique experience for everybody involved. And so we've got this contract for 5 years from Washington, D.C. It's all about funding, which is another area administrators need to know about funding. Nothing's free. Where is this? Who's paying for this? And they are the huge winners of garnering a lot of this funding. It wasn't the medical people, they're too busy doing the medical work. It was the administrators that made it happen. And so therefore, this area got 5 years of this free healthcare. In other words, all those reservists come in. Of course, then COVID and things kind of broke. And I decided, look, we've established processes for this. We can still do this on our own. And so for the past couple of years, we've done this on our own. The university without the Army, and they will be coming, I think, next year with the Navy. But we, for 2 years, decided on our own we can keep this up and let them know we're still here. And don't forget us. And sure enough, they didn't. Still seeing patients, still cranking it out. And I worked just last summer and with 3 or 4 of the admin people who were keeping tracks of the patient surveys, who were keeping track of all the equipment used, who were keeping track of the personnel and the different issues, who were keeping track of the patients and the different concerns that they had, and putting it all together and making it work, making it sure people had equipment, making sure there was a finance, making sure leadership was aware of what it is that needed to be accomplished or how they could assist those who are actively taking care of patients. So the admin people are huge. They're like your right arm. And if you don't have it, you're in trouble. You take care of your admin people. They are really, in reality, the power source. They're the ones that can really help you enormously for whatever venture you want to accomplish.
Thank you.
So any other questions you might have? Okay, ethics, HIPAA. Okay, I want to hit HIPAA. Wherever you go in the healthcare world, you are going to have some pretty unique and dicey private personnel issues, whether it be with the people that you're managing, and you all have that acuity where you know things need to stay in confidence, you need to learn about counseling, you need to learn what to say and what not to say, and keep up with politics, because there are certain words used that they don't want you to use anymore. There's a certain way of talking to people that you have to learn. It's critical that you learn that polished kind of skill to talk with people. But the one thing that's very, very important is to know your environment, know the culture you're dealing with, and also know what the privacy laws are. And they keep changing, okay? And again, those lawyers are out there. And it's not only about those lawyers are out there. These are human beings with unique needs. And they need the privacy. HIPAA, in other words, everything's electronic charting these days. What has been shared? Know what that's all about. That's a huge area where you feel like there's almost a loss of personal contact. You're writing all these notes, but are you even looking at your patients? And in the meantime, who's maintaining these notes? Who's maintaining these records? Where is it? Often some iCloud somewhere. And so it's interesting that when you look at the educational world, the results just came out last week that our national literacy level is lower than it's ever been since the 30s. That's the Depression era. That's sad. Literacy It's that bad. We can't blame it on COVID. We are not reading. We are not really communicating with our writing. We're not. What does that tell you? Think about it. AI is busting its seams. What does this tell you? We have people who are now functionally illiterate with AI busting its seams. What are we going towards? So we've got to have people that are educated enough, and that's going to be you folks, out there educated enough to be able to control these processes in AI. Because again, it is exploding, and that's the way of life. Otherwise, what are we? We have lost control. So again, what is it? Education, education, education. So we have to have unique understanding of the electronic medical records, unique understanding of privacy laws, unique understanding of those dicey situations that you will be involved with to secure a lot of that data. So that's part of the ethics of healthcare. So back on the ranch, an example of ethics and privacy is you can be a rural health, and one of the nurses comes to you and say, this high school student wants birth control, but the mother wants to be there. What do I tell her? I mean, what is it that, I want to give her birth control, but she doesn't want her mother to know. You're going to have that happen. You're going to say, okay, what are the rules here? Let me look it up. Let me see what I can find out. And how do you best protect that child who just wants to not get pregnant? And for the mother, what are the rules to get the mother involved, and how do you handle this? What's the documentation? How do you store that documentation? These areas you are going to be uniquely responsible for, because not only the healthcare industry, but they're going to count on you to guide them on what's the most recent standard. So that's why, and where is this going to put? And who's going to pay for this program that this corporation has, this little say, rural health clinic? Who's going to pay for this? We are programmed. And what's the best program? And what can we afford that is safe and a functioning piece of equipment? Does that make sense? Because you're going to be the one buying it, and it's going to be on you. So it's extremely important to, again, be educated, know the ethics behind it, know the need behind it, and know what your responsibilities are into maintaining that equipment and paying for it, and knowing and envision what we can afford and what we can't afford. So again, it says part of learning, robbing Peter to pay Paul, and working with your medical crew to educate them as to why you're thinking this way. You will also be heavily involved in staffing, heavily involved in, nothing's ever permanent. Nothing's ever permanent. There's always a process to everything. Always in life there's a process to everything. You have to know what that process is all about to make a functioning, effective organization in healthcare.
And I've always tried to push them to keep up with current events. Are there any things happening that you see as being really important right now in terms of healthcare?
Absolutely. In terms of healthcare, what you're going to be required to do, again, is robbing Peter to pay Paul. You've got to keep all your people in healthcare if you really follow what's going on. Who can tell me why Congress is shut? Why Congress is down right now? Bingo. That's one of the reasons. Of course, there's a lot of ancillary political reasons, and it's unfortunate this is happening. Whatever your politics are, the point is healthcare is huge, and what you hear is this healthcare for the migrant population. It's really more than that. But again, that's how they're posturing this. There's a lot of posturing going on, but you need to know, be educated enough to say, okay, what's real, what's the issue, and what we can do about it. So if you don't know about it, you're just kind of winging it and going with the flow, you're kind of cheating yourself. You're cheating yourself because if you don't know what's happening, you won't know what life decisions to make down the road too. Which is the best organization to work for? What are their politics? What's the volume of people that they have? What am I going to have to manage? You have a lot of rural health where we're winging it. We don't even know the amount of people out there to manage. So you have a lot of your what we call FQHCs, or federally qualified health centers, that they are going to rely on you heavily to manage all of this. Manage is, healthcare providers can be like herding cats. It can be difficult. You're going to be the one stuck with, okay, we have 10 people here. Manage it. What's the volume? What's the community? What's the politics behind? What's the culture here? And you have to really keep up with the news on changes that are happening. Will it stay closed for a while? Are people being paid? How are you going to administratively keep people working when you're not paying them? That is going to be up to you, the management and finance people. You will be doing, trust me, you will be doing with a lot of finance obligation to keep the organization going, and organize it, and organize the people, and organize those processes that keep an organization functioning. So heavily in there's a lot of responsibility. So again, it can be wonderful. It can also be a lot of work. But again, know your passion and know what it is you want to accomplish, and take care of your team. Also going around the world, we have a lot of conflicts. Again, we have Ukraine. I think I hit a little bit on that in terms of that conflict. Conflict on multiple levels, very complicated. But then you have refugees. People are running, and it profoundly affected the European healthcare world. Again, know what's happening. Know that now that Ireland basically is shut down, they can't provide anymore. Their healthcare industry it was socialized, you can't even define it that way anymore. They require huge efforts on the part of administrative folks to put it all together. Tell us what we need to do. Tell us how much money we have. Tell us what the vision is. Where are we at? When we have these thousands of people coming in and their families, and a plethora of different social and economic issues that go along with that. Their levels, one from Britain said their levels of child abuse, spousal abuse, family violence, and dysfunction is huge. When you have that kind of migration, you have a lot of social problems. Therefore, you're interfacing a lot with law enforcement. It's multi-level, that we will be heavily involved with those processes in place to support this in the healthcare industry. And a lot's going to be laid on you to coordinate a lot of it. And so people are going to fall back on you heavily. And that's one conflict. The Middle East, the same thing. Lots of conflicts. People migrating, countries that want to take them, and what do? It's a human tragedy in many ways. It's a tragedy we have to manage in the healthcare world. And so you're going to be heavily involved with management.
I know that they have noted that in a lot of the refugee camps, we're starting to see polio again. We're starting to see whooping cough and some of the diseases that used to be under control. What does that look like for these folks?
You're going to be the ones that have to be educated on these vaccines. You're going to be the ones that are in a real complicated world right now, especially in this country. The different attitudes that are being by this administration about vaccines, and I don't want to get too much into politics here, but it is a reality. You have to know the politics. What is the theme? What is the push? I do think it's tragic that polio, we thought that was gone away. You have to, when you flatter a migration of people, mumps, measles, polio, smallpox, leprosy, that's here. And so tuberculosis is on the rise. These are the things you have to, when you have this in your hospital, it's going to be laid on you. Okay, what's the publicity? Where are we with publicity? How do I, as an administrator, represent healthcare and what's happening without scaring the public and the population so much we've created a frenzy? And so therefore we have to have the word skills, the communication skills, the ability to get out to the press who are going to twist everything you say and be able to say, look, we have a problem in this hospital, we have this, and this. This is what we're going to do about it, this, and this is a plan. But you're going to run into that a lot more. And it goes in waves. I hope this wave is something that we can control, but I have a feeling it's going to go on for a while. So things that we thought are gone are coming back. How do we manage tuberculosis? Look at the cost of managing tuberculosis. Look at the infection control processes you have to put in place. It's not the healthcare. You'll be on teams of healthcare leaders, but you will be working with them to come up with a plan on how we're going to do it, how we're going to afford it, and what are we going to do, and what's our vision on what we want to achieve. What are our numbers? How do I report these numbers? Where do I go for these numbers? There's a lot of planning involved that will be your responsibility. So you're going into an exciting area, but one with a lot of responsibility. But the key is getting along with people and having a respect and a vision for what everybody wants to accomplish, and as a team, putting it all together so that you can move forward. So again, you're the right arm. You're the admin folks. You're also the money people. You're the ones that are going to decide, well, can't afford that, but what can we do here? So there's just a lot involved with, depending on where you are, the different obligations you're going to have in your career field.
In this particular unit, we had a section on reporting requirements. And I think a lot of them probably have never thought about reporting sexual trafficking, child abuse, elder abuse. Anything you can say about those?
Oh, absolutely. And the reporting, again, is all confidential. I don't like teaching and not standing in front of the practice. To me, that just seems ridiculous. In other words, as I say, not as I do. I don't work anymore. I just have issues with that. So I work every Saturday, trudge out of bed and go down to the worst area downtown Browning to an FQHC there in Amistad. You dodge the feral dogs if you're going to work, but it's a wonderful thing, and it's a wonderful opportunity, and I've learned a lot. Again, taking care of the underserved has been my passion, my whole career. But in taking care of the underserved, I rely heavily on those who can guide me. We have on Saturdays on the second floor, they have a lot of the females who have been sexually trafficked. And they have their children there, and they take care of them, but it has to be done in a very kind of, not clandestine, but in a very private way for their safety and for their privacy. Because that can be kind of a dangerous format for them. But again, the administrators, you have to report how many you have. You have to know the reporting processes. If you suspect somebody, when you have, say, an patient encounter with somebody who's been sexually or trafficked, you immediately report it to your supervisors, and sure enough, they're going to come to you and say, what's the administrative, where do we go from here? Who do we notify? So you have to go wherever, any organization you're in, what are the notification processes? And then be able to find a source where you can look up the numbers too. And those numbers are crucial in terms of being successful in how you're caring for these people. Are your numbers in healthcare effective? In other words, are you effectively taking these people and caring for them effectively and managing these people and the processes of tracking? And this is called disease surveillance and tracking. And that is the goal of the public health department, which includes a lot of, not just diseases, but a lot of these responsibilities that your FQHCs, your federally qualified health centers, and your public health departments, which are supported by the state, different financial world. These are the different processes that you have, and you have to understand. And they all change too, on what's accurate and what's not. I tend to think, in many ways, we're not so accurate. There's a lot we have not reported well. It's always a process can be improved. I think there's more than one that's reported.
And here in the Coastal Bend, do you have any feel for numbers of child abuse cases or elder abuse cases?
Child abuse on the rise, definitely on the rise. But I think we're getting better at identifying child abuse. However, poverty is an ugly, ugly face. And you have stressors in the family, and you have this migration, and you have more drinking, more, stress. You're going to have more child abuse. It's seen in schools all the time, and I really think a lot of child abuse cases, that's my background, is child abuse, family maltreatment, and sexual abuse. I did that for years, and then I was consultant for the Pacific, and when I was in the Air Force, I got started kind of backed off a little bit because it can be overwhelming. Could report 7 times, one each time, because I knew what I was doing, but very difficult. It's a very difficult, hard area. It's a specialized area that you as administrators get heavily involved in supporting the effort to take care of this higher incidence of child abuse going on. Again, the world's minor. Families, loss of the families. You know, you don't have the grandmother around, the grandfather around, and these extended families to try to help these young ones. And so therefore, there's a lot of higher rate of abuse, sex trafficking. They get older, they run away from home. You know, huge, huge. The numbers, even though we have tried to put all the numbers together, I don't think they're as accurate as we like it to be. It's on the rise.
And any ethical issues around reporting, because I know sometimes.
You're required to report, absolutely. You are required to report. If I suspect it at all, you are required to report. Now there's a way, there's a process. Again, everything's process. There's a process to reporting, but you are required to report it. And there are different organizations. Know in your organization. I'm sorry?
If you report it and it's not accurate, what happens?
Nothing. If you report it, it's not on you and it's not accurate. You reported it. You reported it. This is what I think I saw. You keep all emotion out of it. You report it and let the specialist take it from there. And usually the police will come in and the police will work with your admin folks, coordinate the next step. And if it's positive, of course, you may have to go to court. You may have to just say what you saw and keep all emotion out of it. It's hard to do, but they'll take it from there. So your obligation, if you see it, is to report it. It's up to the specialist to determine what to do. So again, in your organizations, it's important to know who to report it to. That's why you have to have mentors ready to go. Try to link up with somebody who can tell you, I don't know, but I can tell you who to talk to. And that's very important. But you've got to report it. You cannot let it go. And you'll find in some circumstances it's pretty dicey. For example, the young girl that comes in is having a relationship with a 30-year-old guy. She just thinks he's catching me out. It's still illegal. It's statutory rape. And you have to know who to report it to. It's up to them where you're going to take it. But that can't be on you that you didn't report it. So that's by law. So know the organizations. Again, know the people you're working with. When you're just starting out, you're going to run into a lot of these dicey situations. But again, know the reporting processes to go within the organization.
And I know that there was some training that's gone on in our local ERs to identify victims of sex trafficking.
Yeah.
And I think they were doing some research in the CONUS about that.
Well,
Do you
yeah, the
remember?
research is ongoing all the time. Huge research on this.
Yeah.
And my frustration with research is the research is wonderful. There's incredible funds into research, but a lot of that research is on the shelf. It's not put into action.
Right.
And that's unfortunate, but that's the reality. But yeah, the more training you have at your level, the better off you are. At least you need to be educated. Again, education doesn't stop. No matter what you do, as soon as you walk in the door at your facility, your education is ongoing. So go to these educational opportunities. Ask for them. Be proactive. Say, I want to learn. I want to know where I stand. And that just makes you a lot more knowledgeable, a lot better dealing with current events going on, where you can become a spokesperson. You can be the one. And the truth is, you probably will be at one time or another the spokesperson. You're the one that's going to be facing the press saying, this is what we have in our hospital, these are the numbers, this is how we're dealing with it. You're going to be the one that has to explain what the healthcare folks are doing about their given circumstance.
And I really push these guys, and they think I'm nuts, but I want them to be involved in professional organizations. I want them to be involved in community groups.
Yeah.
And how has that affected your career?
Tremendously. Like it was my organizations, we've got, when I became a pediatric nurse practitioner, you had the certification board, certification industry that was to guide you in national. You know, your national certification exam, and then you have opportunities to sit on the board as you go up in your career. And then you have the one I was actively involved with, their headquarters, their certification testing is right there in Austin. And I was one of their professional reviewers. Every Friday I go and help out there at the American Academy of Nurse Practitioners, the AANP. And they're the ones where they would get all of the information, and you have a professional reviewer that would look over everything. In other words, their grades, the college, their clinical experiences. They're all nurses. Are they credentialed in nursing? Do they have the BSN? You know, all these, and see if they are fit to take and can sit to take that certification exam. It's really arduous, but you got a great opportunity to look at all the transcripts throughout the country and in Puerto Rico and Canada on all of these nurses that now want to be nurse practitioners. We have a lot of admin people that would help you because they're the ones that would put this process together so that you could evaluate all of the different programs. You could evaluate all of the different transcripts that came in so that you could make an educated decision to allow this person to sit for the exam. When they take the exam and off they go, they are blessed to be a family nurse practitioner. We have that for ER, we have that for pediatrics, we have that for psych, different certifications. But how do you get this going where you have your admin folks to make sure that everything, all this information, this data, personal information from all of these nurses who want to sit for the exam, that's a lot of personal information, your transcripts, your background, your security checks, your license numbers, all of that. Who's protecting that data? It's that person, that brain behind the program that set it up so that you can appropriately piece it together and assume that this data is safe and that there's not a break in communication or in privacy laws. And that's all the admin folks who enable you to do this. So you evaluate this person, and also what really is helpful is you learn. I love the idea of being on the boards, being able to be a board member, to learn what's a bigger vision, to learn what unique problems are within each organization. What are the trends in nursing? What are the trends in administration? What's happening in healthcare? And that's the only way you can do it is a lot of your organizations where you sign up and say, hey, I want to be a part of it. I want to be a part of knowing something more than just my backyard.
Thank you. Questions? Okay, guys, you guys are not quiet.
I think people are sleepy.
When you were overseas, what was like the most intense medical situation that you faced with like any exposures or just anything that you saw?
Well, there's quite a few you really don't want to discuss, you know, but you kind of put it on the shelf and polish up those memories every now and then privately. But I will say my first airback experience, I was brand new flight nurse, brand new, just made captain, and I was so excited to be doing this as a C9, and we had the Marines that were bombed in Lebanon, 300 Marines. We had to go in there, burns what they call an orthopedic, most of them died, but he was on the airstrip, and they were all sitting out there. The State Department made the plane communication between the government, because security, we had to go round and round and round. Of course, pilots worried about fuel at this point. And we finally got on the ground, and a lot of them died from dehydration, sitting down there on a flight line in the desert sun. But we had to airback them out, and like I said, it was a huge experience in terms of trying to save these people and then put them on a plane. And everybody, I learned the big thing in emergencies, and since then there were several other emergencies. But the one thing I learned right away was one, the team approach, two, communication, and the biggest thing was keep your focus. Keep focusing on that which you need to do, that which you need to accomplish. Because if you don't, you kind of lose track of it. You lose the ability to take care of somebody effectively. And again, like I said, we worked as a team there. We got them out. We did save quite a few lives. We lost several. Most were burned, and then of course. The other was, I don't know if you heard Charlie Wilson's book, it was when the Russians went into Afghanistan. At that point, we were sporting televised. routinely go in on a 141, which is more your plane that goes overseas. The C9 was more intra-theater. It's like a Cadillac of airbags, but when you want to go far distances, you use the 141. So we were on the border of Afghanistan. We weren't supposed to be there at that time. It's all classified. It's not classified anymore. It was all accomplished at night. When you land there and all these potholes and these fires that are on the side, so the poor pilots can find a place to land. And then you get out of the plane, it's like the State Department will come out and you get these briefings from somebody. I learned later it was CIA, it's not State Department. But they would brief you on these patients, and most of them were children that had been heavily, heavily managed through this not great, what the Russians did to these children, throwing chemicals in their faces and whatnot, just horrible burns, a lot of orthopedic, and so most of them girls, the Taliban, females, and they were coming thousands. It was one trip right after another for a couple of months, picking them up, bringing them to Wiesbaden, which is a hospital in Germany, and spending the night there, and then you get on another 141 flight, bring them to the States for more definitive care. And they did that, but their mission, this is all under Geneva Convention, which is wonderful. What a nice thing to do. Well, what are you going to do with these kids once you got them better? The state of Texas took a huge amount. We landed there at Andrews Air Force Base, and then planes from Brooks Army Medical Center and places all around Texas. Texans are lovely people. They're the most generous, giving, good people. And they took these children in. Well, what are you going to do with the children after that? Have you seen Barney World? Plans to send them back to Afghanistan? It was a fractured, that's part of what happens when you come up with these, the road to hell is paved with good intentions. So, there are just thousands of children that damaged done by the Russians. So now we're not Taliban buddies anymore, that changed. But what we were doing, we were bringing missiles in to, it's a good excuse, bring missiles in, has to be done at night, bring it in so that we can better fight the Russians, give them the ability, the equipment to fight Russians, while we take all these children out. We could do it all under Geneva Convention. So kind of a translation, like still to this day. But that's politics, that's the world as it is. But it helps to understand the unique problems that are going on. Nothing's black and white, it's all very complicated. You do a good thing, but it's like medication. You fix something, you break something else. Antibiotics are a wonderful, wonderful source of treatment. They have side effects in anything you do, so you have to be careful with that. So that's, I think, looking back, the most intense, if you want to talk intensity. And there were several of them, but
How many years did you do our diplomatic?
22. I retired as Lieutenant Colonel. And I guess I could have gone more, but my daughter was evacuated, and it was time for me to wind it down and go home and be a mom. So she came to Texas, lived with grandmother. My husband was an airline pilot, and thanks to him, he was able to come and get her and bring her home. But wonderful man. I just lost him a couple years ago. He was one of the airback pilots. That's how we met. So, yeah.
Were you ever scared to become an active military or nurse during that time?
That's an excellent question. That's an excellent question. The truth is, I have to say,